So my name is Fotheringham. I am an obstetrician gynecologist. I've been working for Medecins Sans Frontières on and off since 2011, working as a gynecologist, delivering safe delivery care to pregnant women in various projects, Sierra Leone, Afghanistan and the Democratic Republic of Congo. Okay. Does MSF use ultrasound scans for pregnant women living in conflict situations? So the answer is yes, absolutely. We have the capacity to use ultrasound scans. In the end, the most important thing is that we use all of our clinical skills. So it's really important to take a good history from the woman about what's going on with her. It's really important to do a good examination, to use our skills of palpation, but then we do have the access to ultrasound scan for the questions that you need ultrasound to be able to answer. Okay. There are many critical cases of pregnant women, like the Syrians in Libya, who need urgent support from humanitarian organisations. What role does MSF play in supporting these women? So MSF has projects both in Libya and in Yijib in the north of Jordan at the moment, which is supporting Syrian refugees while they're in Jordan. Unfortunately, it's too unsafe at the moment for us to be able to offer care in Syria itself, but we do support hospitals in Syria that are providing health care for the Syrian population, including pregnant women. I'm in fact the reason I'm in Dubai is that I'm on my way to Yijib in Jordan to have a look at the project there and have a look at how it's functioning and how we can improve the care that we provide. The best support for women in conflict situations is to provide them birth control pills. Does MSF provide this kind of support? MSF provides a large amount of support to pregnant women, but it's certainly true that family planning services are part of a comprehensive women's healthcare package and something that we do provide to women. I think it's not just birth control pills, there are many forms of family planning. Family planning's important in terms of reducing maternal mortality, which is our main goal, because it reduces the number of risk events that a woman has in her lifetime. And so as a result, it can be something that helps to reduce maternal mortality by itself. And that, amongst other reasons, is a reason we provide it. That said, it's always really important what our goal is to support women to safely have the number of children that they and their family want to have. Can you speak more about the role of female aid workers in MSF? Absolutely, obviously female myself. Absolutely, and in a lot of places it's culturally appropriate to provide female healthcare providers. That can sometimes be a challenge for certain specialties, such as obstetrician gynecologists. I think when we think about MSF, we often think about the international field workers, so the people such as myself that will go into somewhere like Afghanistan and work for a few months and then leave again. And we often think about that because we're the people that can come out and speak about it. What we don't think about is our national staff. So I can think of the project that I spent several months in Host in Afghanistan. Yes, of course, we have female international workers, but also all of our local staff are female, all of our local midwives and local doctors, and they do an amazing job of providing health care in situations that are really quite difficult for them. And we come in, we do our best, but we leave again, whereas they stay behind and they will continue on in providing health care for those populations that are in need long after we've left the project. Médecins Sans Frontières provides health care for women in many areas, but specifically usually around delivering their babies around the globe in conflict and non-conflict situations, because it's a neglected disease, an area where there are lots of women dying needlessly, where we feel like we can make a difference. In terms of providing healthcare for women specifically in conflict situations, in fact, the type of healthcare we provide and the problems that we see don't actually really change between a conflict or a non-conflict situation. So when you look at what women die of when they're dying of pregnancy-related complications, it's usually bleeding, it's infections, it's high blood pressure disorders of pregnancy, it's obstructed labour, and it's unsafe abortion. So these are the things that women globally die of. So the problem in conflict situations is more around how we go about providing that health care. And the example I'm going to use is actually in Afghanistan. So in Afghanistan, 2/3 of women give birth without access to a skilled birth attendant. So most births are at home, and when complications arise, it's very difficult for them to seek medical care. One of the things that we've been doing in Afghanistan is putting in place hospitals, which we staff and support in order to be able to do that safe delivery care. In a lot of countries that we'd work in, we'd actually work in a more comprehensive model where we'd have the hospital, but we'd also support outlying health structures where women can go and deliver, and that's much easier for them to access than coming into a big hospital to deliver. And the idea is you go into the little health centre, you have your birth safely and securely, but if a complication arrives, you can be referred into the hospital. But when it comes to conflict settings, that's actually often really difficult. Often it's very hard for those health centres to be staffed. And in the case of Afghanistan, we've struggled with how to keep our staff safe while at the same time support those centres. And usually what we do would be to send midwives out to teach and train. And in fact there we've had to adapt our model and instead bring those people into our healthcare centres to teach and train and support them because we can't go out to them and to the population. It's been fantastic to have the opportunity to come here and talk about the work that MSF does. I'm really passionate about women's healthcare needs around the globe, and I hope that this has given you just a small insight into the work that MSF is trying to do to make sure that every mother and every baby has a safe delivery.